Can you guess what these celebrities have in common?
They are all known to have borderline personality disorder.
Hello and welcome everyone! We are here today to shed some light on the mystery behind borderline personality disorder. My name is Razan.
And I am SYAHIRAH. We hope you find this video educational and manage to learn along the way. Now, let's get right into it. I'm sure you are now wondering what is borderline personality disorder or BPD. It is a complex mental disorder. BPD generally affects 2 to 3% of the population, and it has a lifetime prevalence of 5.9%, which means 5.9% of the population has at some point in their life shown characteristics of having BPD. BPD has been associated with a number of different mood disorders, such as depression, bipolar disorder, and also impulse control disorders like attention deficit hyperactivity disorder, ADHD.
Having said that, the question running around in your head would be, why does this occur? It can be said that there's no single cause of borderline personality disorder and is likely to be caused by a combination of factors. Let's now look at the 4 main factors. Firstly, genetics. There is a large genetic component to whether a person develops BPD. Hazard ratios are used to explain this risk, which show the higher probability to develop BPD versus a person with no genetic relation to someone with BPD. These are as shown here, and as you can see, of all these, having an identical twin with BPD increases your likelihood risk up to 11.5%. A study concluded that clusters of BPD in families have genetic causes and are not caused by shared environmental factors such as socioeconomic status. However, there is a 54% contribution of unique non-shared environmental factors such as trauma or abuse, and this further strengthens the claim that BPD is caused by a combination of factors. The second cause could be imbalance of neurotransmitters in the brain. Neurotransmitters are basically messenger chemicals used by our brain to transmit signals between brain cells. There could be serotonin dysregulation. This phenomenon reduces the sensitivity of the serotonin receptor that may contribute to BPD. This causes an increased rate of learning disorders, attention deficit hyperactivity disorder, and neurocognitive deficits. There is also acetylcholine dysfunction, which play a role in affective instability. On the topic of neurotransmitters, here are some fun facts about those involved in BPD. Firstly, oxytocin. It is highly involved in the regulation of social reward and empathy networks, which may be a contributing cause of BPD and other personality disorders. BPD is characterized by these 3 domains of dysfunction, and there is increasing evidence that the oxytocinergic system may be involved to cause them.
The third cause of BPD could be due to the abnormal neural circuitry. Neural circuitry is related to any control mechanism that regulates activity in the brain. This can be explained by the mesolimbic abnormalities, including reduction in the activity levels in various parts of the brain. These are parts such as the amygdala, hippocampus, and other regions of the medial temporal lobe, which are the key areas in charge of emotional regulation. An important part to note is that the development of these parts of the brain is affected by your early upbringing. These parts of your brain are also responsible for mood regulation, which may account for some of the problems people with BPD have in forming close relationships. Besides that, researchers have used magnetic resonance imaging (MRI) to study the brains of people with BPD, and the scan results have revealed that in patients with BPD, there are 3 parts of the brain that were either smaller than expected or had unusual levels of activity. These parts are the amygdala, this one at the back, which plays an important role in regulating emotions, especially the more negative emotions, such as fear, aggression, and anxiety. The second part is the hippocampus, which helps regulate your behavior and self-control. And lastly, the orbital frontal cortex, the one at the front, which is involved in planning and decision making. Let us move on to the possible final cause of BPD, which is environment factors. Studies have also found an association between environmental factors and the development of BPD. The possible environmental risk factors for BPD includes traumatic life events, childhood physical abuse, childhood sexual abuse, and childhood neglect, mistreatment, or separation from a parent. This can be traced back to the previous point in which it was shown that your childhood upbringing can affect the development of certain areas in your brain.
So, who is at risk of developing BPD? The risk factors are abandonment in childhood or adolescence, a disrupted family life leading to hardships in childhood, sexual, physical, or emotional abuse, family history, and poor communication in the family. We now know what factors may cause it, so let's look at how you can identify the characteristics of borderline personality disorder. Some signs are the fear of being abandoned. Most BPD patients cannot tolerate being alone. They have a strong fear of being abandoned or rejected. Another sign is having unstable relationships with family, friends, and loved ones. People with BPD generally find it challenging to keep healthy personal relationships with others. Rapid changes in self-identity and self-image is another sign. It includes shifting goals and values and seeing yourself as bad or as if you don't exist at all. Next, exhibiting impulsive and dangerous behaviors such as unsafe sexual activity, substance abuse, reckless driving, or fighting. It is important to note, however, that if these behaviors happen mostly during times of elevated mood, they may be symptoms of a mood disorder and not BPD. There's also feelings of emptiness and boredom, feelings of worthlessness and self-loathing, inappropriate, intense anger such as frequently losing your temper, being sarcastic or bitter, or having physical fights, and also paranoia. Generally, if you have BPD, you may worry that people don't like you or don't want to spend time with you. Another key sign is having frequent and intense mood swings lasting from a few hours to a few days, which can include sudden changes in how you feel about others, yourself, and the world around you. Lastly is self-harm or suicidal thoughts. These recurring thoughts of suicidal behaviors such as self-injury or threats is often in response to fear of separation or rejection.
However, these signs aren't 100% conclusive or indicative of BPD. Yet, if patient shows 4 or more traits such as impulsivity, risk-taking, hostility, emotional lability, anxiousness, separation anxiety, or depressivity, then this indicates that they are having BPD. Now that we know what could cause BPD, let us move on to how can we treat it. There are certain medications that may help with the symptoms or co-occurring problems along with BPD, such as depression, impulsiveness, aggression, or anxiety. Medication includes antidepressants, antipsychotics, and mood-stabilizing drugs. However, there are currently no drugs that have been approved by the Food and Drug Administration in treating BPD. So, why do we still give medicine if we know it won't treat BPD? Well, the aim of pharmacotherapy treatment is to reduce the severity of symptoms, improve functioning, prevent worsening of symptoms, to treat co-occurring conditions, and also decrease the risk for suicide. Antidepressants such as selective serotonin reuptake inhibitors (SSRI) are the medication class which is most often prescribed in treating BPD, regardless of coexisting comorbidities. These medications may help with sadness, low mood, anxiety, and emotional reactivity. Examples of SSRI are fluoxetine and phenelzine. Next, antipsychotic drugs are also given as they can reduce anxiety, paranoid thinking, anger or hostility, and impulsivity in patients with BPD. Some examples of antipsychotics are aripiprazole and olanzapine. Lastly, mood stabilizers are used to help treat the impulsive behavior and rapid emotional changes associated with BPD. Examples of mood stabilizers are lamotrigine and carbamazepine.
Psychotherapy, also called talk therapy, is the standard treatment approach for borderline personality disorder. Types of effective psychotherapy include: the first is dialectical behavior therapy, DBT. It includes group and individual therapy and uses a skill-based approach to teach you how to manage your emotions, tolerate distress, and improve relationships. There is also schema-focused therapy. It can help to identify unmet needs that have led to negative life patterns. Therapy focuses on helping you get your needs met in a healthy manner to promote positive life patterns. Another psychotherapy is systems training for emotional predictability and problem-solving steps. It is a 20-week treatment that involves working in groups that incorporate your family members, caregivers, friends, or significant others into treatment. It is used in addition to other types of psychotherapy. Lastly, good psychiatric management. It focuses on making sense of emotionally difficult moments by considering the interpersonal context for feelings. It may integrate medications, groups, family education, and individual therapy. As with any illness, BPD patients need a strong support system to help them recover well. Here, we have listed out a few handy tips for their caregivers since we believe that to help someone, you must first take care of yourself. Firstly, recognizing the signs and symptoms of BPD is very important. BPD patients may be extremely sensitive, thus even small things or events can trigger intense reactions from them. They may not be able to think straight or calm themselves in a healthy way. They may also say hurtful things or act out in dangerous or inappropriate ways. This emotional volatility can cause turmoil in their relationship and stress for family members.
Besides that, you may be putting most of your energy into the person with BPD that may lead to resentment, depression, burnout, and even physical illness. In fact, many friends or family members often feel guilty and blame themselves for the destructive behavior of the borderline person. You may question what you did to make the person so angry. Think you somehow deserve the abuse or feel responsible for any failure or relapse in treatment. Some things to remember is to learn how to manage stress, never neglect your own physical health, try to avoid the temptation to isolate, and to remember the 3C. It is important to remember that you are not responsible for another person. I didn't cause it, I can't cure it, I can't control it.
Lastly, as a caretaker, you should listen actively, be sympathetic, and try to make the person with BPD feel heard. Avoid distractions when communicating with them. Try not to interrupt or redirect the conversations to your concerns, and try to show your interest in what's being said. You should encourage professional help. Individual and group therapy have been shown to reduce some of the more difficult symptoms of BPD. Mental health professionals can also assess for other mental disorders requiring treatment, such as anxiety or depression. For this final segment, we'll be comparing borderline personality disorder along with a mood disorder that it's commonly mistaken for bipolar disorder.
Firstly, BPD is a mental illness marked by severe emotional dysregulation.
Bipolar, on the other hand, is a mood disorder characterized by depressive and manic states.
Next, BPD can cause mood swings last for a few hours.
Mood changes can last for days or even weeks.
Besides that, depression, impulsivity, and unstable personal relationships are common in BPD patients.
Bipolar depressive episodes can cause depressed mood and feelings of guilt and fatigue.
BPD patients can have regular sleep cycles.
In contrast, bipolar patients tend to have extremely disturbed sleep cycles during periods of mania and depression.
Lastly, BPD is treated through therapy such as DBT.
Lastly, treatment options for bipolar disorder include psychotherapy and medication. Thank you for watching this far. We hope you now have a clearer understanding of borderline personality disorder.
Do give us a thumbs up if you enjoyed the video, and thank you for watching.